We're going to switch up the agenda and kick things off by hearing from Dr. Nicole Lurie. She is the Assistant Secretary for Preparedness and Response here at HHS. The mission of her office is to lead the nation in preventing, responding to, and recovering from the adverse health effects of public health emergencies and disasters. She's been spending much of the last couple of weeks in Flint, Michigan, responding to the water crisis there. She's just a few minutes to talk with us today before she leaves again for Flint. So we asked her to share a story from her perspective on invention and innovation in emergency preparedness.
Thanks so much. It's fun to be here, and I hope I can stimulate some thinking. And I'm always really excited to share what we've been doing in the innovation space. I thought I would just give you a couple of examples from our own work and take it from there. Before I do, I'll just comment that it is really a lot easier to get to yes if you don't have to go through no first. You can get there going through no, it just takes a lot longer. So as you think about and formulate what you're doing and how to get there and when you ask permission and when you don't and all of those things, just do what you can do to avoid the opportunity to hear the word no before you get to yes. So that would be my overarching framing comment, because it's just all too easy in government to do it the other way. So I came to ASPR in 2009, and since then have been doing a bunch of really fun things in the innovation space, and I thought I would just tell you a couple of things about them. So first thing that I was pretty struck with going out to disasters is, as one public health officer said, all of these people came out of the woodwork and we didn't know they were there. Health departments in general have no idea who lives in their community. And one big part of the community are people who live at home perfectly well on their own with durable medical equipment of all kinds, except that it is electricity dependent. So it means when the power goes out, people get in trouble. So I went to a scene of a tornado, and there was a gigantic tree in front of somebody's house, and the ambulance was there 3 days after the storm. I said, so how come the ambulance is here? The tree didn't fall on her house. And they said, oh, she ran out of oxygen. I said, why'd she run out of oxygen? We don't know. Well, why didn't her oxygen tank send a signal that it was almost out of oxygen, and somebody could just go bring her another tank and she wouldn't have an exacerbation of her lung disease and end up in the hospital? So that's where my quest for this started. So my quest to solve that problem took a couple of different turns. One was, a health department not knowing those people are there is frankly not acceptable. And I frankly said, darn it, I'm going to make it so they know that they're there. So I went to CMS and I said, I think you buy durable medical equipment for most people in the country. Turns out they do for about 85% of the people in the country. Can you tell us who those people are and where they live? Said, how could we work this out? Because all this information ought to be in a public health safe harbor. Fast forward to now, we have a system, we just did it in Flint, where within a couple of hours of request, CMS is a response agency. And it now makes available in real time, sets up a password protected website, has the names and addresses of everybody who's got water dependent, durable medical equipment, and people have gone and knocked on the door of all of those people, like people have dialysis at home and people have tube feeds, and make sure that they have safe water. We've done this now for Restorm. We can get de-identified data, put it on a map, know how to prioritize power restoration. For this last storm, lots and lots of health departments are in the path of the storm, asked for the de-identified data, which we're really excited to see because people are using it. So track one, just leverage the data we have to do good things with it. We're able to do this because in addition to data warehouses, which we can decide about their value, CMS also gets data in real time to track, to look for fraud and adverse patterns. And it's that real-time data that's not, the bills aren't paid, but it's sort of good enough that lets us do it. And the accuracy rate of that stuff has been 93, 94, 95%. So I'm happy with that, good enough for government work. Doesn't have to be 100%. The second thing we did is say, how do we make it so that your equipment sends a signal? So we did a couple things. We were in the first cohort of people that experimented with having an innovation fellow. And we learned about the Innovation Fellow program and how to, I think, strengthen it. But in the meantime, using really cheap pieces of equipment, Raspberry Pi and Alamode, pieces of equipment, for under $70, built a prototype device that would plug into your durable medical equipment, read its battery life, and send a signal. Okay, so that's pretty good. We got a prototype device out of this pretty quick. We then learned that every device manufacturer has its own source code, and so you can't have a universal device. We had to solve that problem. We went out to NIST, National Institute of Standards and Technology. We explained to them what the problem was. They got behind it, and they just voted on a data standard like 2 weeks ago for durable medical equipment. The international community is really eager to take this on and sponsor it as well, and I think by the end of the year, we ought to have an international standard for how these devices transmit. So that then provides the opportunity for many more innovators and inventors to come into this space, and there's going to be a marketplace and a market for people who can monitor these devices. Very excited about that. At the same time we had our Innovation Fellow here, we've done a number of challenges and competitions. We sponsored a challenge and competition for sort of ideation around this. And the winner was actually a public health service officer and his neighbor, who was an engineer who lived out in Maryland somewhere. And they had a really interesting idea about how to do this, but they didn't have any of the wherewithal to take this forward. 2 years after I sponsored this competition, I got a letter in the mail from a guy named David Lee, and he said, "Hi, my name is David Lee. I'm a 16-year-old student in Long Island, and 2 years ago I entered your competition. My dad had to open an account for me because I wasn't 18, and I won $2,000. And I took that money and I bought a bunch of other equipment and I set up a prototype device and I've tested it in my community. I have a patent pending. Here's my publication. I want to tell you about it." So he came over this summer, Susanna came, and we met David Lee, who was thrilled to have his picture taken with me because now he's famous. And just very, very sweet. But he had a really cool idea that none of us had really thought about for how to have a system of tracking people's medical equipment and having it report out. So he's off to Caltech in the fall, and I think he will do great things. But we had a lot of discussion about youth and youth innovation and how to get youth more involved in this space. And so we've got a competition out now just as a youth video contest for how to do more work in the preparedness space and how to engage youth. But that's also just been a very fun thing. Last, because I know my time's almost up, we've been trying to innovate with the private sector. So learning from Empower and thinking about, so another reason that people get into trouble in disasters is because they don't have their medicine, or they didn't get to pick up their refills before they had to evacuate or whatever. Thought, well, how could we solve this problem? Well, we don't have all those data. But you know what? You get calls from CVS and Walgreens and all those places all the time. So we called up CVS and we said, "So what do you think? You think before a disaster that you could text or robocall everybody and tell them to go pick up their medicine before, stuff gets bad?" They said, "I don't know, but we'll try." So they tried for the flooding that hit South Carolina. They called about 600,000 households. They got a lot of really great social media feedback. They just finished analyzing their data about 10 days ago and saw a pretty big increase in people who picked up medicine. So I don't know if any of you got notifications for them, but they notified 1.5 million people in the metro area before this storm hit. We'll see what the data look like, but they got amazing social media feedback, and for them that was a success. So, you can innovate kind of all over the place, inside of HHS with data, with contests, with getting young people involved, with inventing stuff, and leveraging private sector assets to help meet your mission. So we've just had a great time doing all this and put that all out on the table for you. I will tell you one last thing, which is that we, together with the Idea Lab and lots of other places, are opening a large innovation lab with a gigantic sort of simulation visualization space in the basement of the O'Neill Building. Space for everybody to work and play and innovate. There's going to be this very cool thing called the Cave, which is 3D visualization that you can sit in and work in. And we've broken ground, and we are hopeful that that will be up and running as a community asset for all of us in Asper. You know, it's a really great question. If ordinary Americans were measuring their own water quality through high resolution, would we have been able to prevent the Flint water crisis? You know, I just didn't have time. I was actually going to talk about crowdsourcing. I don't know the answer to your question. I suspect that we would understand that lead in the water is probably pretty epidemic, and be differently enabled to do something about mitigation and improve water quality all over. Right now, I've been pretty focused on trying to figure out other ways that we can crowdsource information from the citizens of Flint. Is there simple testing that people can do at home and post on a website? So just like people found all the oiled birds during the Deepwater Horizon crisis and went and cleaned them off, we could be crowdsourcing data on water quality and responding to it, or crowdsourcing information about who doesn't have water filters installed, and doing something about it. So there's a lot of opportunity for innovation there. I think your idea is a great one. So I'd love at the end of the day to be able to, you know, put a little piece of, you know, filter paper or dipstick under the tap and have people be able to report their water quality. Maybe you could get to work on it. Thanks.